As part of its advocacy program, Tracker monitored some projects in Amuzu community in Amaimo, Ikeduru local government area of Imo State. Tracker's point of call in the community is an abandoned healthcare center, which is a federal government project. A visit to the health center shows a fast dilapidating structure that is under the threat of collapse and decay.
Because of chats with the community chairman, he also took us to the primary health center that has been constructed 5 years ago in the community, and which happened to also be the only primary health center in the community, but unequipped.
According to some of the community leaders, the structure has been in the state for the past 5 years and nothing is being done to put it into use despite being completed.
This structure here has been here for the past 4 years as a hospital, and it's only the structure we are seeing, and the contractor didn't allow anybody to fix anybody, even if it's ordinary maternity, into it, and there is no medical facilities inside the hospital, so we can't use it. Looking at it just the same way, seeing everything going down, while we know that the federal government spent a huge sum of money to make sure they put this here, so we are feel that something has to be done fast, or else, the way I'm saying it, if we continue like this for the next a year or two, part of the building will start falling off, and that will not be the best for us.
On how members of the community currently handle their health challenges, leaders of the community have this to say.
This project was completed 5 years ago, and since then we have been trying. Many of our women, pregnant women, in the night, so we'll be on that level. You have to trek, so we deliver on the road.
The nearest health center here is about 3 kilometers. That's the Amimo Health Center. People who have problems, especially in the midnight, so some of them will trek all that distance where there is no transport. In our community of over 5,000 inhabitants, we need to have a health center. But in this case now, this is there, and nobody is operating, it's not operational. No equipment, no doctor, no nurse. Instead of our people here to enjoy this facility, they go outside. They travel long to go and have a medical facility, which is terribly bad.
At a point, owing to the continuous frustration the community was facing in this regard, they muted the idea of bringing in a private body to run the completed facility in order to ameliorate their pain. But they met a brick wall in the contractor.
Community decided to use it as a dispensary, to bring in a private operator to operate here as a dispensary. But the contractor that handled the project refused it. She asked us not to come into the project. She asked us not to tamper anything in the house until the federal government finish payment. We don't know the federal government that are owing the contractor. All we need is for the facility to be functional so that we will continue to use it.
There was a time some of our sons abroad wanted to invite private medical practitioners here, but the woman contractor refused, said we should not bring anybody here because the government has not paid them. So that is why this hospital is like this.
On what the community expects from the government, Chief Eku has this to say.
We are asking the federal government, the state government to come for our aid. This community needs a hospital. We need a hospital. Even if this hospital is operational, other communities around us will benefit from it. So it's better the federal government or the state government to come and see what they can do. The structures are even going down. Some of the ceilings are falling off. Some of the toiletries and other things fitted in are just going down without being used. If it's in use, all those things will not go that same way. We plead and we hope they will hear and come to assist us.
Without mincing words, the suffering that the people of this community have been subjected to due to bad leadership and corruption is audible to the deaf and visible to the blind. High infant mortality rate, loss of lives to minor ailments, just to mention a few, are some of the price this community has been paying due to corruption and may continue to pay if basic health infrastructure is not provided as soon as possible. Amuzu community is not a wealthy one, but has all the potentials to produce men and women who could rule the world. But without good health, how can this dream come to pass? Like the saying goes, health is wealth. We need to make basic health infrastructure a priority, not only in Amuzu community, but across the country.